Back right now, 9:24. More than 40 million people in the United States suffer from the pain and frustration of migraines. June is National Migraine and Headache Awareness Month, so we're looking at some of the different advances on treatments with Dr. Reena Mehta of the Uptown Allergy and Asthma Clinic. So, Dr. Mehta, let's first talk about what is a migraine and how does it compare to just the regular headache that people get?
So as you mentioned, headaches and migraines are really common. And so as you said, 40 million Americans suffer. So this is not an uncommon situation. Now, there is a difference between migraines and headaches. When I think about migraines, they're usually more severe. They can last anywhere from 4 to 72 hours and often can be associated with other symptoms such as nausea, vomiting, maybe even light and sensitivity to sound and light. Often people with migraines will have almost like an aura where they feel it coming on. And migraines can be quite debilitating. Often people with migraines cannot perform everyday functions. They need to go lie down until the migraine passes because it can really affect their functioning.
I can speak from experience. I sometimes do experience migraines, and the visual aura that you mentioned where you start getting that little flash of light and then all of a sudden it kind of moves to the side, and then within 30 minutes you get the headache. Now, is there anything you can do, or I can do even, that when that aura comes on, is there a way of stopping or reversing that?
Sure. And so, I mean, we've made advancements with medications quite a bit over the last couple of years when it comes to migraine treatment. And so there are medications that you can take acutely that can actually try to abort the migraines. And then if your migraines are happening frequently, you may actually be on a preventative medication as a way to try to prevent the migraines from happening. There's all sorts of new techniques when it comes to migraines as well, because often with migraines, your typical ibuprofen or Aleve is not going to quite turn it around. And so if your migraines are severe, you probably want to talk to your doctor or your neurologist about different techniques, because now they have all sorts of neuromodulation techniques, which includes things like electrical stimulation to the trigger points, which actually can be the cause of migraines. And so sometimes calming down the nervous system through sometimes electrical stimulation can help with the migraine headaches.
So when it comes down to getting that headache and you may feel nauseous, blurred vision, you may feel weak or weary, when is the point where you say, you know what, this is not the average headache, I need to go seek help or maybe go to the ER? What is that trigger point, and what do we have to know in terms of if it's that dangerous?
So that's a great question. And so, when we think about headaches and migraines, a lot of people experience them. But, the question becomes, it's when it's outside of the realm of normal. So I would say if you experience symptoms such as blurry vision, loss of consciousness, intractable vomiting, or you have this feeling of this is the worst headache of my life and something is just not right, that's when it's time to go to the emergency room or the urgent care for further treatment and evaluation.
So when it comes down to triggers, I guess maybe a journal would be a good thing. My doctor said, all right, Bruce, what did you eat? Did you eat chocolate?
Yes.
Did you drink coffee? Did you caffeine, cheese, things like that? And I think my trigger may be a lot of cheese. If I eat a lot of heavy cheeses, sometimes it'll bring it on. And it's like, I love pizza, I love cheese, but sometimes you just have to kind of, get away from those things so you don't get those migraines.
So that's exactly what I recommend to patients, is keeping a diary or a journal and recording all the things that you did that day when you had your migraine or your headache. And so what you ate, how much sleep that you got, where is your mental health, how stressed are you, because stress can be a big trigger of migraine, what did you do the day before and the day of, how much water did you drink? Are you dehydrated? Because that can be a big trigger of headaches. The other thing to think about is allergies. So do you suffer from nasal congestion and sinus pressure? And does it happen this time every year? Because that can also be a trigger of headaches as well. So keeping track of what's happened in your past and what happens surrounding the headache can be really helpful, because if you understand your triggers, then you can often avoid them and prevent the headaches from happening.
All right, Dr. Reena Mehta, thank you very much. And I guess the best advice is if you feel you have the headaches coming on or you've been getting them, just talk to your doctor about it and get that treatment.